Hello, everyone. A very beautiful Sunday morning to you all. Today, I hereby welcome you all on Instagram Live Guest Talk with Homeopathy Heals episode 94. Our today's guest is very much loved on Instagram. She is, so much admired female homeopath, this young generation homeopath. Let's not waste a single minute and add our guest of honor today. And she is here. She is none other than Dr. Tanvi Mahant, who is MD homeopathic consultant, and she is founder and owner of Homeo Heals at Malad West. She is a former assistant professor at CMPH Medical College, Vile Parle West. She is a well-known homeopath practicing in Mumbai since 2013 and has a clinical expertise in treating all acute and chronic cases, all allergic, menstrual disorders, infertility, orthopedic cases. Her YouTube channel, Homeo Heals, is a platform created by her, and it has more than 50 videos which focus on spreading awareness about health, wellness, and homeopathy. She's a very active on Facebook and Instagram, and she do share her health tips videos regularly so that it get benefit to the society. A very, very warm welcome to you, ma'am.
Thank you so much, Dr. Annam. And it was really a very warm introduction and a very good morning, a good Sunday morning to you too. And I would like to mention that I've been following you on Instagram since quite a long time, and I think you are being you inspire so many young doctors, young homeopaths, and by your live session, which are so helpful even for practitioners like us. There are so many eminent homeopaths, stalwarts who have come on your platform, and it really encourages doctors like us also to practice homeopathy and increase our knowledge as well.
Thank you so much, ma'am. Thank you so much for kind words. And even today, I am very much excited about the today's session, role of sphere of action, because I have seen when I was doing my MD, everyone was talking about vital force, and at times I have questioned myself. Okay, what if not vital force, as written by Master Hahnemann and Organon? What is curative in medicine? And it has lightened up a curiosity inside me. Okay, what is there in homeopathic medicine? Then later, after reading few books and attending few seminars, I came to know about active principles. I came to know about that there are certain affinities of drugs over human body. So even this is one of my most favorite topic we have ever, you know, uh, scheduled in till 94 episodes. So let's not waste even a single minute. And I would like to ask you why you have selected this topic for discussion.
Yes. So, uh, as you clearly mentioned, like I was teaching in CMP college, and I myself have done my BHMS from CMP. So, I feel basically in Mumbai, the entire practice is more focused on Kentian method. Till now, obviously now there are doctors who are practicing other methods also, but the main focus, like for 4 years in my OPD, I used to see that there was a totality which we follow in Kenton. Mine was given more preference than the physical generals particular, and so the main approach was also a lot of focus was given on mind. So sometimes, and as a teacher when I was there in CMP, I also saw that students get lost so much in the mental symptoms that they get confused, that they get so much deep down the uh, grief or the fastidiousness or whatever of the patient, that they get lost and they forget what is the pathology of the patient, and that also has to be given importance. So somewhere there is a lot of confusion which I feel as a student I also faced, and the students of today's generation still after being so much of awareness, there is still confusion. Secondly, also I would like to give that in my this pure of action sort of role or importance was imbibed in my mind very early in my student life. So there was a teacher, uh, Dr. VV sir, what we call Dr. Vijay Vaishnav sir. I don't know if you
I
know.
know it.
Yeah, yeah. So I got to learn from him for a very brief period of time because after that he left CMP. So when I was in my second year and I used to attend his OPD, firstly I saw that his prescriptions were very quick because his OPD also used to have 50 to 100 patients. Secondly, I saw in every patient, okay, he used to give a lot of importance to the diagnosis of the case and कि joint में affections है तो joint में कहाँ पे affection है, like for example कि if you take knee joint में ligaments भी है, cartilage भी है, menisci भी है, ligaments भी है. So where is the pathology affected, and accordingly he used to prescribe homeopathic remedy and I used to see very excellent results. So this thought or this was there in my mind, and so what I'm trying to say, whatever method or practice we follow, whatever, maybe it Kentian Boger, sphere of action is something which should not be missed anytime when we prescribe in our clinic. And that is why I thought that this topic is very relevant. And whatever way, whatever method you follow, sphere of action should be given importance in prescribing. So I think that's why I chose this topic for today.
My next question is, in which cases you will use a spare of action for prescription? You just spoke
Okay.
about quick prescription, right? And the new budding homeopaths, they are so impatient. As soon as patient come and sit and start, even if patient says I'm having burning, they barely ask about it, they barely inquire about it, and they start, being impatient for giving or prescribing sulfur.
Right,
So,
right.
yeah, just a mode of a quick prescription. We have spoke about it. What case you think are very wise where we can use spare of action as prescription?
Okay, so first of all, it's a very good question and a very broad question. So I feel first we'll start with very basics because I think a lot of students are also watching this Insta live session. So see, sphere of action, as I mentioned earlier, also should be given importance in every method of prescribing. Maybe you have a chronic case which is coming to you, you have an acute case, you have an emergency case. Obviously, in acute and emergencies or acute emergencies, sphere of action helps us in quick prescribing, right? So when you know a patient is coming to you with, for example, acute exacerbation of asthma, right? If you take an asthma, so there are 4 5 remedies, maybe there are more than that, which have action on lungs, right? And so what are you going to do is you're going to match the so again, what mistake the budding doctors make that, as you mentioned, burning dikha to sulfur de diya, and then they don't get results, right? Because sulfur is not the only drug for burning. So similarly, if a patient is coming to you for breathlessness and we have remedies which have affection in your lungs, it most common being arsenic alb, you have your blata orientalis which has been proved for asthma, right? You have aspidosperma and you have many more drugs, right? So कि अभी acute exacerbation है, मुझे एक ड्रग चूज करना है जिसका स्पीयर ऑफ एक्शन लंग्स पे है, अस्थमा पे है, and once that episode settle, maybe you can choose a drug which is going to settle the chronic complaint. So again, when you prescribe in acute emergencies, after taking into consideration sphere of action, right, you need to consider the pathology also and the symptom similarity. Symptom similarity is most important, right? In homeopathy, the basic symptom, like even Dr. Hahnemann has mentioned everywhere in 153, he writes about the striking peculiar symptom, right? So उस अस्थमा में भी कैरेक्टरिस्टिक क्या है वो आपको ढूंढना है, एंड दैट कैरेक्टरिस्टिक जो रेमेडीज है, ब्लाटा है या आर्सेनिक एल्ब है, ओके, एंटियम आर्स है, आप कौन सा रेमेडी चूज करोगे? लाइक फॉर एग्जाम्पल अगर आईसीयू में केसेस में जा रहे हो, राइट, पल्मोनरी एडिमा है, कार्डियक कंप्लेन की वजह से रेस्पिरेशन अफेक्टेड है, यू माइट थिंक ऑफ एंटियम आर्स. आई एम जस्ट गिविंग एन एग्जाम्पल. सो while prescribing, you need to consider the sphere of action, most importantly, the pathology and the symptoms, the characteristic symptoms. Only then you will have, a prescription which is going to be short, and which is going to work. I'll give another example, I think a very basic, as we are talking about joint affinities, right? अभी एक पेशेंट आपके पास जॉइंट पेन लेके आता है, right? And we talk about very basic remedies, like for example, bryonia, Restox, Ruta, which are the very common remedy. I think everyone is aware about these remedies, right? Now, अगर जॉइंट पेन्स के लिए कोई पेशेंट आता है, मे बी एक ही जॉइंट इन्वॉल्व है, नी जॉइंट इफ यू टेक, राइट, और आपके पास अगर इन्वेस्टिगेशन है तो वो भी आपको हेल्प करता है प्रिस्क्राइबिंग में. सो लाइक फॉर एग्जाम्पल, वी टॉक ब्रायोनिया is known for its affection in serous membrane, right? So if serous effusion है और ब्रायोनिया के symptoms है, indicated symptoms है, characteristic symptoms है, modality है, right? So you can think of bryonia. वैसे रूटा, अभी ankle sprain में हम usually रूटा देते हैं. Why? Because रूटा has special affinity for ankle. It has special affinity for ligaments and tendons, right? Similarly, Ruta also has affinity for cartilages of the joint. तो आपने देखा होगा बहुत सारे डॉक्टर्स, इवन वी, अगर मेनिस्कल टेयर होगा नी का, so we usually use Ruta, because rather than using Restox, rather than using Brownia, rather than using Arnica or Lidim, we use Ruta. Why? Because Ruta has more affection for cartilage and meniscus than the other drugs. Similarly, Restox has more affinity for your ligaments, right? Your tendons, and then you have ailments from overexertion. So, sphere of action may be when you go finer, okay, in differentiating, the prescription will become more correct, and the results will be more definite. I think I'm able to make sense, or is it little confusing?
नहीं ma'am.
Okay. So any other questions if any of the audience have? Otherwise, I'll give you a more example of what I'm going to say, that sphere of action consider करने के बाद भी pathology consider करना भी बहुत important है. That's what I'm trying to say. If you want to, I know that this topic is your favorite as well. So if you want to share any your experience, that would also be great. Yeah.
Ma'am, I want to ask that taking account sphere of action, does it mean ignoring the totality of symptoms?
So definitely not, right? That's what I'm trying to say. So अभी इसका बहुत, I think, सीधा example है, and there was a lot of discussion about bogus synoptic key. There were so many live sessions conducted by Dr. Abhishek Joshi, right? So बोगर सिनॉप्टिक की अगर किसी ने इंट्रोडक्शन उसका फॉरवर्ड पढ़ा है, सो डॉक्टर बोगर हैज वेरी नाइसली गिवन दैट हाउ टू प्रिस्क्राइब अ रेमेडी फॉर अस एज होम्योपैथ्स, राइट? What should be given importance? And if you, I think everyone should, I read Boger Synoptic Key, he has given that when you prescribe a remedy, you have to give importance to ailments from the causation, right? You have to give importance to the sensation of the patients, right? You have to give importance to the modalities. You have to give him, and mind also he gives importance. He said mental disposition, which helps to differentiate between the two remedy. And he has written at the end, organ affected, right? So whenever I'm prescribing for any patient, I am taking into consideration all these factors. Maybe दिखता है कि हमारे जो स्टॉलवर्ड्स है वो क्विक प्रिस्क्रिप्शन कर रहे हैं कि देख लिया और एक रेमेडी दे दिया, बट दे आर कंसिडरिंग ऑल दिस, राइट? फॉर एग्जाम्पल, अभी मैंने सिंपल रेस्टॉक का एग्जाम्पल दे दिया. कोई आया कि बहुत शोल्डर पेन है, एक दिन पहले उसने कुछ दिवाली का सफाई किया, उसके बाद पेन चालू हो गया. सो यू आर टेकिंग इनटू कंसिडरेशन द एलिमेंट्स फ्रॉम, ओके, ओवर. So everything has been taken into consideration. So Boger ने जो लिखा है, I think It is so valid in practice, and you have to consider all these things in your totality, and only then you will get results, right? So I think that makes it clear. Now I'll give you another case example. I think that will help
Yes.
people to relate more. So recently I had a case of cirrhosis of liver, and to be honest, I have not treated many cases of cirrhosis. This was my second case. All right, so obviously I've learned few mistakes which I had made in my past patient. I wanted to be very thorough that the patient should get results. The patient has come to us with an hope of getting results. So he was my old patient, and accidentally he got diagnosed with, accidentally means he had abdominal pain and vomiting which was not settling for a few days, and he went for investigation and he came to know that he had cirrhosis, and it was an acute episode of jaundice, and that's how he got diagnosed. So after all that settled, he came to me as a homeopath that he wanted to take treatment from me. Okay, so I asked about the history, will not go too much into the detailed history, but what in my mind I had, that I had to have a drug which is going to cover this pathology also, and obviously the mental sphere of the patient. So my first prescription in this case was Carboveg, okay, which was why, because this patient, okay, uh, he had cirrhosis for a very long time, okay, but he was completely asymptomatic for a very long time, and entire body, his constitution was very sluggish and slow with a lot of venous stasis. That means he had only presentation was edema of legs, okay, and in general also, okay, his reaction was very slow. So that's why the first prescription was Carboveg. After that, okay, Carboveg was just to bring up more symptoms. The second prescription which I gave, when I inquired, he told me that he has little bit involuntary stools. That means agar कुछ भी थोड़ा सा भी कुछ हुआ, या early morning he has to get up with that urge, and sometimes he passes that flatus, और उसके साथ कभी कभी little bit stools also comes up. Okay, so this was the symptom. He had a very sedentary life. ऐसा कुछ ज्यादा, ऐसा जॉब भी ऐसा था, सिटिंग प्रोफाइल का था, कुछ ज्यादा एक्सर्शन नहीं है. ऑब्वियसली एंजाइटी तो हो गई, सडनली सिरोसिस डायग्नोस हुआ है. So the remedy, I think anyone wants to say. So there are very few symptoms I know, but still, if you think about the other symptom which he had in his diagnosis was cirrhosis to diagnose ho gaya tha. He had esophageal varices, okay, which was there, and the doctor were going to plan to ligate the cirrhosis, the varices. He
Sorry.
also had, yes, anything else? I'm audible?
No, no, ma'am. Continue.
Yeah. He also had episodes of bleeding in stools. Okay. That means he also had hemorrhoids. So all the symptoms, because of his cirrhosis, there was portal hypertension, right? And there were symptoms of portal hypertension, which was presenting with esophageal varices, which was presenting with hemorrhoids, bleeding in stools. Along with that, he had laxity or involuntary stools, okay, sedentary life. And so any guesses with the remedy, if anyone wants to? And why, how he got diagnosed with cirrhosis, I'll tell you, there was no history of exposure or nothing. There was only history of blood transfusion. Okay. So in 10th, now he is in his 40s. So when he was in 10th standard, even this, I didn't know that he mentioned that he had met with an accident, and after which he had been given blood transfusion. All right. So in that, it was because of blood transfusion, and he suffered from hepatitis C, and that is causing cirrhosis. So alcohol is not a cause. So giving more clarity that it was not alcoholic induced cirrhosis, it was hepatitis C induced cirrhosis because of because of blood transfusion. So any guesses with the remedy? Anything which is coming up? Okay, I know. Okay, any remedies which you know which are known for cirrhosis and portal hypertension, you can write down. I think you have been continuously doing this Sunday live session, and I've seen they have been quite active. I've seen few sessions. So I don't want everyone to be just, so you can write any general remedies, and it is a general remedy for cirrhosis and portal hypertension. Okay, very common remedy. I might be wrong. Yes, lycopodium. Someone is writing sulfur. Okay, again, a very big polish. Sulfur comes up for everything, right? Whenever you repertorize any case, right, sulfur is going to come as a remedy. Someone mentioned cardus. Very excellent remedy. Cardus marina for cirrhosis. Yes, Nux vomica, very excellent. Asculus. Okay, so we have Hamamelis, very good. Yes, someone has mentioned aloe, chelidonium. So we have a lot of remedies which are coming up. Now, someone mentioned collinsonia. So again, see, our topic is look at the pathology, look at the sphere of action. Collinsonia is known for, it has a sphere of action for piles, right? But piles more during pregnancy which is causing the congestion and hemorrhoids, then collinsonia is going to act well, right? So consider the pathology and yes, Nux vomica is a very close remedy, and I was going to think of Nux vomica in this case. But if you see ailments from, okay, Nux vomica, that's why I mentioned the patient was not alcoholic. If the patient had been alcoholic and it was an alcoholic induced cirrhosis with involuntary, ineffectual urge for stool, which is there in Nux vomica, which we had in this patient. So had this patient be having lifestyle like Nux vomica, right, which is Vaxavika is too much into. I remember our sir used to, Enogoil sir in our CMP used to tell Naxomeka with 3W, okay? That is wine, work,
Fine.
and
Well,
woman, right? So if that person constitution was like that, I would have definitely think of Naxomeka. But someone has mentioned the remedy in the comment section, that is aloe, okay? And it was a very simple prescription. Aloe, if you read, has a very good action on portal congestion. I think the first few lines which are written in our Materia Medica focuses so much on portal uh, congestion causing hemorrhoids, causing esophageal varices with that involuntary stools or passing of flatus and passing of stools, right? Plus sedentary lifestyle, which is again written in our Materia Medica. So aloe was a drug of choice and not Nux vomica, which I think I've mentioned. And lycopodium, I think sulfur, there are polycyst remedies. They have again lycopodium constitution is completely different. We will not go into the details. So that's what I'm trying to say. When you prescribe, take the characteristic symptoms, take the ailments from, take the totality, take your pathology and sphere of action. Okay. So I'll give an example from one of our Materia Medica. I think that will make that example somewhere open my mind also whenever I'm prescribing now. Okay, so I'm a big reader of Dr. Burnett also. Okay, I personally like his writing when it comes to pathological cases. Okay, functional cases are very easy to treat. Okay, but when it comes to pathological cases, I really follow Dr. Burnett's writing. And I think in his book of tumors, okay, he has mentioned a very nice case of a congestion of brain. Okay, so there was a young girl, if those who have read his book on tumors have read this case. So he writes in his book about a case of a young girl who used to come to the OPD for congestion of brain with redness of face, okay, and all the symptoms typically pointing towards belladonna. We know belladonna is a very good drug for congestion where the face turns red and headache, okay. So every time the girl used to come with this episode, they used to give belladonna. At the end, in one of his visit, again they gave belladonna. The patient used to get better, okay, with belladonna. But again and again, the episode used to come back. And one time the girl came with the similar symptoms, they gave belladonna, but the girl died. Okay, the girl could not recover. And later on, when they found out the pathology, okay, of her congestion, headaches, face turning red was tuberculoma or tuberculosis of the brain. So what I'm trying to say is belladonna, though having sphere of action to the brain, the pathology of belladonna is completely different. It doesn't cover tuberculosis, right? So, so in homeopathic language, if we talk, we have to consider the miasm also while prescribing. Okay. So here you would have thought of a drug which has action on as a for tuberculosis with affection on brain, maybe iodine or something like that. I'm just giving iodoform. So whenever you're prescribing, having given importance to the sphere of action, give importance to the pathogenicity of the drug also, and which you also mentioned in the beginning about the uh, sphere of action, pathogenicity, active principle, how in drug proving. Okay, so that's why it's so important to read our provings also sometimes. What changes it is causing in the body clinically, how in what cases it has been verified. Okay, and then if you use, I think that would be but a good prescription. Yes, doctor. Anything?
As we are talking about, ma'am, a sphere of action,
Hmm.
can you please throw a little light on organ specific remedies?
Okay, okay. So definitely we spoke a lot about sphere of action, and just before going talking about organ specific remedies, I would like to make a point very clear, because again, I don't want the doctors or young doctors to get confused. Okay, so when you're giving prescription on totality, or when you're focusing a case on mind, okay, and I practice that way, right? Because I treat a lot of endocrine problems and infertility problem where you give so much importance to the mental symptoms, and there has to be some grief or some ailments from which has caused change in the body, or the goiter to come up, or something, or the hypothyroid to come up. So I give equal importance. Okay, what I'm trying to say is, if you consider a, and this you will understand when you study materia medica also. So vice versa. So if a patient comes to us with repeated griefs, okay, बहुत सारा grief हो रहा है, repeated grief है उसके life में, okay, so you're confused. Should I give Ignatia or Natrimune? I'm just saying. So Ignatia ka sphere of action is more only on mental sphere. Okay, it will not cause physical ailments. It will not cause a lot of chronic or physical ailments as per like Natrimure. Ignatia, इसलिए Ignatia को कभी-कभी हम लोग acute of Natrimure भी बोलते हैं. So if you see it is just a functional problem, physically patient एकदम healthy है, you can think of Ignatia, because sphere of action is that. Deep pathology involved हुई है repeated grief के बाद, obviously you take into consideration a lot about the symptoms also. You think of giving Natrimune. उसी के साथ स्टाफ भी आप लोगे रिपीटेड ग्रीफ और रोमांटिक ग्रीफ जिसे स्टाफ में भी बोलते हैं. उसके बाद उसका पैथोफिजियोलॉजी क्या है कि प्योर ऑफ एक्शन फिजिकली वो क्या करता है, इंड्यूरेशन करता है. इसलिए अगर ग्रीफ के बाद ट्यूमर्स है, राइट, कोई, तो यू कैन थिंक ऑफ स्टैफिसाइग्रिया. सो आप अगर मेंटली भी कंसिडर करें कोई भी केस को, उसके जो लाइफ पैथोजेनिसिटी ड्रग में क्या रन कर रही है, उसका पॉलीक्रेस्ट रेमेडीज का हम बात करें तो देयर आर मल्टीपल स्फीयर ऑफ एक्शन. सो इसलिए हम बहुत बार पॉलीक्रेस्ट यूज कर लेते हैं बहुत सारे कंप्लेंट में, बट फिर भी देयर इज अ स्पेशल एफिनिटी फॉर in polycrest also for different organs. I could go on and on in this topic, but we'll just end over here, and we'll go to the topic of organ specific remedy. Uh, so organ specific remedy, as we are talking about sphere of action, and I think everyone is aware about organ specific remedies, right? So and I think now the talk is a lot about organ specific and rare remedies. Okay, what there's a lot of talk. So it is a remedy which has special action on a specific organ, right? So that's why it makes sense with today's topic. So how I encountered, okay, obviously we have read about it, but how I personally started using it. So I've been practicing, as you said, since a long time, 13, 14. So, but before marriage, I had a different clinic. Okay, in my young days, I had a different struggle. And when I got married, I started my clinic in Malad in the year 2019. Okay, there was a patient who used to come to me regularly and for some skin complaint. So he just mentioned that, doctor, my mother, okay, she had a myeloproliferative disorder. And I used to see that every 15 days uska na hemoglobin drop hota tha, and every 15 days transfusion karana padta tha. Okay, so it is 2018 or 19. I don't remember exactly. So he was just narrating his complaint, and he had a lot of faith on me, and the family was taking treatment for a long time. So I just mentioned कि एक बार लेके आओ मम्मी को. I'll try if homeopathy can, you know, do something. I will be really helpful to, you know, help you, because 15 days में hospitalize करो, blood transfuse करो, money भी जा रहा है, और वो pain, everything was very not bearable for them. So there was a huge file. Okay, she has been through doctors and doctors. So I'll just tell you in gist. So उसका anemia का अभी main reason क्या था कि she had hypersplenism, splenomegaly था, और it was grade 4. मतलब उसका spleen अगर आप feel करो तो umbilicus के भी नीचे था. Okay, so there was huge splenomegaly she had, and अभी डॉक्टर ने उनको स्प्लीनेक्टमी भी एडवाइस किया था कि that is the reason that if you do that, obviously RBC का destruction नहीं होगा and the hemoglobin will not come down. So obviously they did not wanted to do a splenectomy. It's a huge risk. So I saw splenomegaly है. Okay, अभी एकदम जिस्ट में बोलूँ तो anemia है. Okay, I took the history. Okay, and constitutionally she was going in the natrum group. Okay, she also had a history of tuberculosis in the past, and natrum में भी constitutionally I prescribed a natrum sulf, because natrum sulf has a lot of affinity. मैंने repertory में उस time बहुत देखा था कि leukemias और leukemias associated with anemia, natrum group में natrum sulf में ज़्यादा affinity था. So constitutionally I gave him natrum sulf. But after giving few episodes of natrum sulf, symptomatically she improved, but spleen के size में और वो anemia का जो उसका था उसमें मुझे इतना improvement दिखा नहीं. So then I thought कि no, I have to give something else, and that is where I use Ceonanthus americanus, okay, which has marked affinity on spleen, okay, and there are many drugs, but Ceonanthus अगर आप पढ़ेंगे तो उसमें लिखा है anemia associated with splenic disorders. Okay, so again you have to look at the characteristic symptoms pathology. So because उसमें anemia था, because of the spleen enlargement, right? I prescribed her Ceonanthus americanus, mother tincture में prescribe किया, and उसके बाद 2019 के बाद कोविड आ गया, हॉस्पिटलाइज करना कितना डिफिकल्ट था रूटीन पेशेंट्स के लिए भी. So you'll not believe, in entire 2020 she did not require transfusion even once after starting Ceonanthus americanus, and I was really shocked because ऐसा मेरे life में भी it was like a turning point. Not only that, the splenic size has also reduced. Obviously इतना drastic change नहीं आया था, but few millimeters, a few 1 centimeter से spleen का size भी कम हुआ था, and transfusion भी नहीं लगा. So that is my turning point, जब मुझे लगा कि sphere of action और organ specific remedies कितना काम करता है. और apart from giving constitutional remedies, I had to give an organ specific remedies, and it was going on. Okay, if someone might ask कि कितने दिन के लिए दिया, तो for an entire year Ceonanthus चालू ही था. Okay, 10 I think 5 or 10 drops BD, it was going on and on. Okay, so this was my first encounter, and I think I mentioned this case before also. And after that, ये तो मैंने बोरिक से पढ़ा था और दिया था. उसके बाद because it was a spleen complaint, I started reading Dr. Burnett's writing, because he has a entire book on spleen. And तब मुझे strike हुआ, he has written so much about Ceonanthus, and then I read his all other booklets which are there. So this was my encounter. Another case similarly, okay, ये तो बहुत recent case है. So again, I see a lot of endocrine cases. So एक goiter का case था, okay, and she was hyperthyroid with a huge goiter. Exophthalmos था. So constitutionally, I was giving her Kali iode. Okay, Kali iode. Lot of symptoms. Also, she had diabetes, which begin with goiter. So diabetes with goiter. If you see, Kali iode is the only drug. Okay, another characteristic. So again, in spite of giving Kali iode, okay, symptomatically she was doing much better. Thyroid report better हुआ, पर जो goiter था, again it was not reducing even by a single millimeter. That is what my observation is. Okay, और मैंने अच्छा 6-7 months more than that I was only giving her Kali iode. Okay, then but obviously she had also come for me with goiter and she wanted results in that as well. So again काली आयोड के साथ उस केस में मैंने फ्यूकस वेसिकुलोसिस स्टार्ट किया. Fucus vesiculosis और उस vesiculosis अगर again if you read from Boric, okay, exophthalmos goiter, all right, with obesity. Now इस patient में अभी जब beginning में वो detect हुआ था तभी she had the symptoms of being lean, thin, losing weight. अभी बल्कि she is gaining weight. Okay, she's turning a little bit towards overweight and obesity. So exophthalmos goiter with obesity, okay, hyperthyroid, fucus has a very good affection as an organ specific remedy, right? And there are so many literature available about fucus and treating exophthalmos goiter. Again, I started fucus, and in that case also I'm getting results now in the case of goiter, right? So talking about organ specific remedies, I think when you should use in your practice as a beginner, when you're dealing first of all with pathological cases, okay, tumors हो गया, okay, fibroid हो गया. So fibroid में very routinely we use either aurum nitronatum, we use sabina, we use all these remedies. So Fraxinus americana. So when you're treating pathological cases, you should use organ specific remedies. And many doctors, okay, then after that I also heard Dr. Borkar. I think he also had an Insta live session with you, right? And I heard him in one of his webinar, and I saw that he is also somewhat using the similar approach and similar lines, and he also mentioned using organ specific remedies as drainage remedies, right? So that is another way where you can use this. I will not go into too much of detail. Drainage remedies means like in this patient spleen was at fault. Okay, spleen में problem था इसलिए बाकी symptoms आ रहे थे, right? So spleen का toxin reduce करने के लिए जब आप एक specific remedy use करते हो, that could be called as drainage remedy, which could be Sionanthus. So that is where organ specific remedy which has special affinity towards a specific organ in pathological cases, I have experienced, to be honest, very very good results using them in pathological cases. Yeah, anything which you want to add, Dr. Anam? Please go.
Ma'am, what you're saying is absolutely apt. Today I'm enjoying the session like audience. More than a host, I am a listener today and I'm enjoying to fullest. There is a question from audience. Dr. Mehra is asking, good morning, ma'am. What is the approach of cases of pineal gland cyst?
Oh, pineal gland cyst. I have also not treated that, but I think pineal gland cyst, I think you can use sarcodes also. I think there is something prepared from pineal gland. I think that could somehow help in treating such conditions. Okay, so I think sarcode would be helpful in treating this condition along with the constitutional remedy. I feel that could be the approach. So constitutional with a sarcode, okay, will give, I think, a good results in such cases. I have not treated a pineal gland cyst. I have not got such patient. Yes.
Ma'am, my next question is that we have discussed a lot about affinity of drugs and sphere of action. Uh, my next question is, if students or the people, those who are getting a benefit from this session, they want to read about it, can you recommend some books to study sphere of actions?
Okay. So whenever I'm confused, okay, like for example, if I have some drug in mind and there are two, for example, take very simple polycrest remedy. Okay, अभी एक ही uh, अभी very recent I had a case where I was confused between pulsatilla and cocculus. Okay, very confused, and the case was of varicose veins. Okay, so and pulsatilla cocculus का constitution भी disposition भी very same line पे जाता है. तो I opened bogus synoptic key, okay, and I saw जो left में, okay, he writes about sphere of action, right में he writes about modality, right, in bogus synoptic key. So I opened bogus synoptic key, I opened pulsatilla, I opened cocculus, and मैंने देखा कि pulsatilla का sphere of action में veins लिखा हुआ है, right, and cocculus doesn't have that affinity. So, so I went ahead with prescribing pulsatilla. So I feel bogus synoptic key is a book which every homeopath should read as a beginner also. Okay, it gives so much clarity. And as we were talking about quick prescription के लिए भी बहुत अच्छा है. Sphere of action देखा, modalities देखा, और नीचे वो एकदम कैरेक्टरिस्टिक सिम्टम्स देखा, आपने प्रिस्क्राइब कर दिया. सो बोगस सिनॉप्टिक की इज वन ऑफ द excellent book to read about affinity. Then obviously Dr. Clark also writes a lot about sphere of action. Okay, so dictionary, practical dictionary of Clark's Materia Medica, उसमें काफी sphere of action के बारे में लिखा है. अपना बोरिक also writes a lot about sphere of action. Okay, अगर थोड़ा हायर बुक्स की बात करें तो डॉक्टर मर्फी, ओके, नॉट हायर बट लोटस मटीरिया मेडिका इज, हाँ, जो बाय डॉक्टर रॉबिन मर्फी है, ही आल्सो writes about sphere of action very excellently. So these are some books I think which you can use and which are very simple. Boric, okay, and Practical Dictionary of by Dr. Clark. Okay, ये तीन books में तो excellently दिया है. And if you want to read more, you can refer Lotus Materia Medica by Dr. Robin Murphy.
Uh, there is a question from audience. I'll pick it up. She's asking, can we opt for organ-specific medicines in acute cases?
Okay. Very good question. Yes, definitely you can use in acute cases और acute emergencies में भी use कर ही सकते हैं. Organ specific remedies क्या है जिसका affinity एक organ पे सबसे ज्यादा है. जैसे अभी हमने बात किया सिमिलरली ब्रेथलेसनेस के बारे में बात किया, अस्थमा के बारे में बात किया, राइट. तो अक्यूट एक्सैजरेशन है, आपने एस्पिडोस्पर्मा दे दिया जो ऑर्गन स्पेसिफिक रेमेडी है, राइट. सो अक्यूट इमरजेंसीज में भी ऑर्गन स्पेसिफिक रेमेडीज काम करती है. डिजिटालिस बात कर लो, okay? किसी को अक्यूट कार्डियक फेलियर हो गया, राइट, यू यूज डिजिटालिस. ओके, सो it is again an organ specific remedy which is being used in acute emergency conditions. So yes, acutes में भी आप organ specific remedies definitely use कर सकते हैं. जैसे अभी simple, अभी female हम लोग के पास patients, even you must be getting a lot of female patients, right? So menorrhagia, menometrorrhagia is so common these days because of so many hormonal pills. And so whenever there is menorrhagia, you're looking for what? You're looking again for an organ specific remedy, right? Thalaspi देना है, sabina देना है, trillium देना है, okay, millefolium देना है. This drug has a special affinity for blood vessels. So these are also in somewhat sense an organ specific remedy which has special affinity for female sexual organs, okay, special affinity over blood, and that is what you're going to use. So yes, acutes maybe you can use.
Ma'am, my last question for the episode is, please throw some light on sphere of action and posology. In which potency repetitions we should prescribe organ-specific remedies, or our prescription is based on sphere of action.
Okay. So there was just one more question which I read. I think that I think we'll skip. So you mentioned about posology, right? So posology, anyways, it is a very debatable topic, I feel, and so every homeopath is very free to explore. I feel it's their own through their own experience, through their own learning, and that is how I feel anyone can learn. Okay, आप mistake करोगे एक potency देके उसके बाद ही आप सीखोगे. But saying that, in our literature, okay, stalwarts have mentioned कि अगर आपका ड्रग सही है, okay, if your remedy is right, if you give in any potency, आपको रिएक्शन दिखना ही चाहिए, right? तो पोटेंसी का इतना जो इशू सबके माइंड में है उतना होना नहीं चाहिए. ओके, अगर उस बहुत क्लियरली लिखा हुआ है कोई भी पोटेंसी तो मैं दो, ड्रग क्लियर है, एक्ट करेगा. अगर नहीं एक्ट कर रहा है तो आइदर देयर इज सम माइजमेटिक ब्लॉक, उसे निकालो, या फिर आपकी रेमेडी गलत है, राइट? सो दैट इज व्हाट यू हैव टू कीप इन माइंड फर्स्टली. सो पोसोलॉजी को एकदम इतना जितना हम लोग डर जाता है उतना होने का जरूरत नहीं है, और सिंपल है. जितना कैरेक्टरिस्टिक सिम्टम्स है उतनी हाई पोसोलॉजी होगा, राइट? जब हम ऑर्गन स्पेसिफिक रेमेडी के बारे में बात कर रहे हैं, हम लोग ओवरऑल इंडिविजुअल को इतना इम्पोर्टेंस नहीं दे रहे हैं, हम ऑर्गन को इम्पोर्टेंस दे रहे हैं. सो ऑब्वियसली स्पेसिफिक होम्योपैथिक स्पेसिफिक रेमेडी है फॉर दैट ऑर्गन, इसलिए उसमें पोसोलॉजी कम ही होगा. सो दैट्स व्हाई ऑल ऑर्गन स्पेसिफिक रेमेडीज आर यूज्ड आइदर इन मदर टिंचर्स or the use in 3x potency or 6x potency. जब आप स्पीयर ऑफ एक्शन को लेके कोई रेमेडी दे रहे हो, ओनली स्पीयर ऑफ एक्शन को, और उसी में कैरेक्टरिस्टिक ढूंढ रहे हो, जैसे हमने ब्राउनिया रेस्टॉक्स रूटा की बात की थी जॉइंट के ऊपर, और कैरेक्टरिस्टिक ढूंढ रहे हो, मोडालिटी और प्रिस्क्राइब कर रहे हो, यूजुअली गो फॉर लोअर पोटेंसीज 6C 30. ओके, जब आप कैरेक्टरिस्टिक ज्यादा है, आप okay, overall picture consider कर रहे हो ज्यादा, तो obviously you go for 200 and higher potency, more than that, right? So I think it makes it simple, right?
Okay, we have covered almost questions of audience also, I guess. And those who have more questions, I will be dropping ma'am's email ID, so you can directly mail her and ask all your, remaining questions. So we are towards the ending of the session, and thank you so much, ma'am. It was so insightful. It was so interesting, and live viewers were also. It was not dropping at all. Everyone was enjoying the session, and thank you so much for sparing valuable time, that too on Sunday, for us.
Yeah, and thank you so much, Dr. Annam, for inviting. I know for last 1 month, we have been trying to have this session because of some disturbances. It was not happening. And it was really great talking to you, and you are doing so well on Instagram also, personally, in your life. And so again, I was really confused about the topic, because for me, okay, we know Dr. Satyajit, okay, he's very, very close to me, and I see a lot of endocrine cases. So firstly, I thought I will take endocrine as a topic, but then I thought this topic is something which is very close to my heart, and I apply so routinely in practice. And personally, I think me, and as how much I know you, I give a lot of importance to clinical examination and clinical findings. Okay, I have been personally also, and my student life afterwards. So this topic would make more sense. That's what I felt. And again, thank you so much for inviting me here, Dr. Annam. It was really great talking to you.
Thank you so much, ma'am. And as a ritual, we take promise from our guests that they will come again with another topic on any other episode as per their schedule very soon.
Yes,
This should not
definitely.
stop.
No, it will not stop. Definitely, I enjoyed it a lot, and definitely I look forward. Yes,
Thank you so much, ma'am.
yes, thank you so much, Annam. Yeah.
So I hope you all have enjoyed the session. It was really very insightful, very amazing session, and very practical. What answers homeopathic critics need, actually. So someone asked about that materia medica by bird. Yes, it is also. And even Blackwood Materia Medica also give you some insight about pathophysiological action. That's one of my most favorite book, and I keep on ranting about it. I hope you have loved the session. Do not forget to write in the story next coming up that what you learned about today's session, what you loved about it, and keep us promoting and loving so that we'll have more and more episodes of Instagram Live Guest Talk with Homeopathy Heals. Till then, stay fit, stay healthy, Homeopathy Heals.